Hi. It has been a really difficult year so far, few weeks, and a lot of people are feeling empty, numb, depressed, shut down, which is totally understandable. So, today I'm going to talk a little bit about how to handle it when everything just feels empty or meaningless. Hi, I'm Emma Coble. I am a therapist and I work with clients in Colorado. My practice is all online. I also work with clients in Florida. So, one of the hardest, I want to say that I think that one of the loneliest, hardest experiences that we have as human beings is this feeling of emptiness, numbness, nothing really mattering. Other experiences like panic and sadness and shame, those are really, really painful too. But there's something about this just hopeless emptiness that can feel so discouraging and almost impossible to get out of. So, this can be also really terrifying because it doesn't always have a bunch of symptoms that kind of tell you that it's here. And again, like it can feel like no one else is going through this but you. It is not a sign that you are broken or that you can't be fixed. So, we're going to talk about what this is and how to be with it. So, first of all, you might be exhausted or burnt out. I know that I have personally been incredibly exhausted and burnt out with looking at the news, but also social media and how much things are in our faces these days. In addition to just all the normal stressors of life, like we are constantly bombarded with horrible news about things happening in the world. And in response to that, like our body becomes burnt out, our body becomes exhausted, our body starts to shut down. When this happens, oftentimes, because I do internal family systems and parts work, I think of it as a protector is coming in who is trying to protect you from feelings that might feel overwhelming. So, actually, the numbness itself, this part, is afraid that if you feel the feelings, that they're going to overwhelm you or are going to cause chaos or that you won't have the capacity to deal with feeling the extent of your emotions. This is something I see all the time with clients. They're afraid that if they really let themselves feel that they're going to become overwhelmed, they're going to become unable to function, or this part at least is afraid that they're going to become unable to function and do what they need to do. Old trauma also ties into this because oftentimes it's been really adaptive to disconnect in this way in order to protect ourselves from being completely overwhelmed and overtaken. Sometimes we are living also in a way where we're disconnected from ourselves. We are just people pleasing, achieving, caretaking, and we are exhausted. And this part comes in to sort of protect us from the feeling of emptiness that might be occurring because we're not really living in line with our values or listening to our inner voice. And again, this can be super confusing because it can show up as this sort of depression, this numbing. It doesn't look like a sadness always. I mean, there might be sadness underneath it. You might know that there's sadness underneath it, but it can just look like a blankness sort of, or like a deadening feeling inside or a despair. And so this can again be really hard to work with because it can be hard to pinpoint like what exactly is wrong, like what is the problem. And I do think therapy is a great place to work that out if you are in this position. So again, like this part is protecting you from being overwhelmed, being overtaken. It's trying to help you possibly function. Maybe it thinks that feeling empty is safer than feeling abandoned, rejected. So how do we approach this? We want to approach this part with a bunch of curiosity, gentleness, kindness, without trying to force it to go anywhere or to go away, but to just be very receptive to the fact that it's trying to help us. So I want also to remind you that if this part is really active, it's a sign that there's probably some unmet need. So maybe listening to asking this part what it is that it actually needs. Is it trying to tell you, like, I'm tired, I'm overwhelmed, I'm really scared, I need to be taken care of. I've been going so much. There's an old hurt wound that I don't know how to be with. So remember that, again, the emptying, numbing part is trying to help you. So the first step in all of this is, again, just to name that this is happening, name that there is a part here that is trying to protect you, that it's not the entirety of you that is numb or empty. This is a part of your system doing a job to help you. And then approach it with curiosity. What's it afraid would happen, or what's it afraid you would have to feel if it weren't numbing you out? So just kind of get curious. See also if there's a younger part beneath this. So if there is maybe a young kind of exiled part that it's protecting, like a deeply lonely part, a scared part, one that experienced emotional abandonment when you were young. Just sort of notice those things. Show it a lot of compassion, as I said, and listen to your body, not always, the story that you might get lost in about the state of the world or whatever it is that's happening. And then I would say also, name figure out kind of what's missing, and reduce pressure. Reduce pressure for this to go away, reduce pressure for yourself to feel better. Invite it in, but this is a part that is protecting you right now, and it's scared, and it's really trying to help you, and that's actually a really good thing that you have this system. And sometimes it might be, working in a way that is also causing you pain, in which case I would reach out to a therapist like myself, but potentially someone who does some internal family systems or has experience with trauma to work with this part. And if there's another part that even feels guilty about having this part, notice that is totally normal, and also have some compassion and acceptance toward that part as well. So just recognize through all this that your nervous system is trying to protect you. There's something tender here, and if you do want to chat, I offer free 15-minute consultations. So I hope you have a great day.